Others, Michael and Dennis Dorso, are braving the COVID-19 pandemic across two separate states in the United States. They are emergency room doctors treating an onslaught of COVID-19 patients in two very strained hospitals. Their conversations now give us a glimpse into the struggles of frontline workers, along with the mayhem and havoc wreaked by COVID-19 on the country's healthcare system. Here's a report. When the coronavirus hit New York City, emergency rooms were flooded with patients. Stories of sickness, urgency, risk and loss inundated hospitals. Trapped behind masks and face shields, medical workers scrambled to save lives. And soon, New York became the epicenter of the COVID-19 outbreak in the United States. And now New York's fate is being replicated in the Sunshine State, Florida.
It is unfortunate that a lot of the other cities around the U.S., including down in Florida, are now being hit basically as bad as New York was. I was kind of hoping that as bad as it was in New York was going to be enough of like a forewarning for the rest of the other cities around the U.S. that we would be able to prevent the spread or prevent it from hitting such high numbers every day. But it seems like some other states and cities have actually surpassed New York's peak numbers of new cases.
I think that's one big difference, is that when everything was hitting kind of nationally in the US, the first time everyone kind of braced like a full force, dig in, sprint kind of response. And now that we're several months in and we're still seeing almost near our peak numbers down here, you can see the effects of time, of just the stress of working so hard and pulling in new resources to keep up taking care of these patients. It's become a marathon, and we've been running it at a sprinting pace, and that shows in multiple ways.
A marathon it is indeed for those on the front lines, like these twin brothers Michael and Dennis Dorso. While Michael offers advice from his experience of battling the outbreak when cases peaked across New York City, Dennis expresses frustration at the complete disregard for social distancing and mask mandates in the state. New York recorded around 66,000 cases a week at its peak in April, at a time when Florida's peak weekly rise was 7,500. But by July, ER doctors like Dennis braced for mayhem as Florida recorded more than 80,000 cases a week. For now, New York appears to have flattened the curve.
Having seen the numbers decline and not having every conversation of every shift be about whether this patient has coronavirus and whether we're going to need to intubate them has relieved a lot of the stress. And so that has made things a lot easier since the start. But there was a long period of time where basically all you did was work and stay inside to avoid potentially being exposed or exposing other people. And that got very, very difficult.
What shocked Dennis even more was the onslaught of young, healthy patients flooding emergency room corridors in Miami. For now, the United States continues to be the worst affected country with more than 5.3 million COVID-19 cases. But it seems that at times, stories of life and death often bring people together.
I got to talk to my dad about seeing a pandemic that he'd never seen to the extreme in his time. And I got to describe it to my twin brother before he started seeing the cases. And we talked as a family, and I think it got us closer together because we're talking about life and death. And it's always in the background of being an emergency room doctor, but this kind of brings it really up close and personal because people from every age and with or without medical problems were getting very sick and dying from this condition.
Doctors like Michael and Dennis are overwhelmed by the severity